Dr. Scott Schreiber here, talking about shoulder injuries. So one of the areas that is really not addressed when it comes to shoulder injuries is the scapula, the shoulder blade. Its positioning is super important when it comes to shoulder injuries. So many times, if you look at the back of the shoulder, the scapula here, this is the ribs or the thoracic cage there, it'll be up like that. So what happens in those types of situations, the whole upper extremity, the whole arm is off, and structures are working harder or not working enough, and over a course of time that can just lead to injuries unto itself, not only of the shoulder but also the neck, the elbow, the wrist. If the shoulder blade isn't working properly and isn't moving properly on the back of the wall. Arm is different than the leg because it's what's called open chain versus the leg, which is closed chain, meaning that the leg actually makes contact with the ground. Our arm's the only contact that we have, is with the scapula on the body. So if that's off, the whole arm is going to be off. So definitely super important. I always check that when it comes to upper extremity injuries, particularly shoulder, but also we look at things like tennis elbow, look at things, even wrist strains and things like that. So I have several patients that come in that are in gymnastics or in yoga, and they're doing these inversions, and where it's not their wrists are really causing a lot of problems. It's not necessarily the wrist that is the cause. It's usually up north, or more in the shoulder blade, that's actually causing a lot of the issues that then can transfer down to the wrist. And the wrist, yes, you're feeling pain in the wrist. Yes, the wrist is sore. But if you want to, I can adjust the wrist. I can treat the wrist all I want. But if I don't treat the other areas of dysfunction, it's going to come right back. So the big thing is make sure that you're not only the wrist itself is being treated, but also the other areas that can be causing a lot of those issues. Again, this is everything I do. We really get into the functional exams. We look at the various muscles, look at the motion, make sure everything is working properly, and if it's not, we fix it. So that's what we do here at Minnesota Spine and Sport. If you have any questions, feel free to reach out. I'll be more than happy to answer them. And talk to you guys soon. Bye.